Well, it's time now for Health Report, and joining us now is Africa 54 Health correspondent Linord Moudou. Hello, Linord.
Hello, Vincent. Researchers are calling for the sale of tobacco to be phased out by 2040. According to new research released in the British journal The Lancet, researchers from the University of Tokyo show that although overall rates of smoking are slowly declining, the prevalence of tobacco use is actually expected to increase in some countries over the next decade, notably in Africa and the Middle East. 1 billion deaths from smoking and other forms of tobacco are expected by the end of this century. Because the world's population is rising, there will still be more than 1 billion smokers in 2025 unless global action against tobacco is taken. And the World Health Organization has issued a new guidance recommending that adults and children reduce their daily intake of free sugars. The WHO recommendations are based on analysis of the latest scientific evidence, which shows that adults who consume less sugars have lower body weight. Research also shows that children with the highest intakes of sugar-sweetened drinks are more likely to be overweight or obese than children with a low intake of sugar-sweetened drinks. Dr. Francesco Branca, director of the WHO's Department of Nutrition for Health and Development, elaborates on the new guidelines.
The new WHO guidelines recommend to reduce free sugars intake to less than 10% of total energy intake, which for an average adult means roughly 50 grams of sugar, corresponding to approximately 12 teaspoons. For additional health benefits, WHO also recommends to further reduce the sugar's intake to less than 5% of total energy. The new WHO guidelines refer to free sugars, that are the sugars added by the cook or by the manufacturers in the production of food, but are also naturally present in fruit juices and in fruit juice concentrates. These are not the sugars that are naturally present in fruit, vegetables, or in milk.
Countries are encouraged to translate the recommendations into food-based dietary guidelines that consider locally available food and customs. Now, health officials in Malawi are working to ensure that cholera does not spread into camps hosting victims of recent flooding. At least 90 cholera cases have been reported in various parts of the country.
Thousands of people remain in displacement camps several weeks after flash floods killed over 100 people in Malawi. Over 300,000 others are now homeless. Health officials say there is a cholera outbreak. Meanwhile, aid groups are campaigning to improve water and sanitation facilities for people living in the camps.
I have learned that whenever I visit the toilet, I must wash my hands. Also, when I change my child's nappies, I must wash my hands. Cleanliness must be observed when we prepare food and also around the camp to avoid contracting diseases like cholera and dysentery, and we are all practicing that.
There is a concern cholera could spread further, and health experts warn that if the situation is not addressed with urgency, there could be more death. Charities are stepping up programs to educate people on how they can prevent cholera by practicing good hygiene.
These videos are so important because it's also a mode of communication. Looking at their pictures that are translating, we can always translate into activities that are going on.
The United Nations and its partners are allocating $9.2 million in emergency funding to save lives and bring help to people in 3 districts hardest hit by floods in southern Malawi. The money will help provide food, shelter, education, water sanitation, and other emergency aid to more than 270,000 people. Aid workers say many people are likely to require assistance in coming months.
What could happen more is if we had funding from whosoever, is to erect more pit latrines, conduct more hygiene promotions, and give these more safe water. Yeah. Because what you have is 2 boreholes, and those 2 boreholes are under pressure from these 10,000 people and the original inhabitants of this village.
More than 70% of Malawi's population are farmers living in rural areas. Days of torrential rain in recent months have destroyed thousands of hectares of crops, raising fears of a poor harvest.
And that's our Africa Health Report for today. Back to you, Vincent.
Well, Linord, thanks a lot, and be sure to check out Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.